welcome back to my channel, which is Real Homeopathy. Please do like, share and subscribe to my channel, and let's go directly to today's class. And I'll be explaining today on syphilis, which is a topic from sexually transmitted infections. So today I'll be explaining only on syphilis, and in that I'll be even explaining on of organ of medicine and materia medica. Okay, there are certain types here. First one, there is a gonorrhea. Second one, you'll see syphilis. Third one is chlamydial infections. And fourth one, you'll see chancroid, which is a soft sore. And fifth one, herpes genitalis. Sixth one, bacterial vaginosis, which is BV. The last one is granuloma inguinale donovanosis. Again, there are types, which is HIV, AIDS, all of it. Today I'll be explaining on syphilis, only in brief. It is a must-know question where they will be asking this question for 5 marks. So it is caused by the anaerobic Spirocheta treponema palladinum, caused by the anaerobic Spirocheta treponema pallidum. So the syphilitic lesion of the genital tract is acquired by direct contact with another person. So it is directly coming in a contact with an infected of another person. Infection जो infected person है उससे contact हुआ है तो आ जाएगा syphilis. So this is a direct contact. So this syphilitic lesion of genital tract is by direct contact. Who has open primary or secondary syphilitic lesion? Okay. Transmission occurs through abraded skin or mucosal surface. Coming to clinical features, the incubation period ranges from 9 to 90 days. The primary lesion, cancre, it is single or multiple and is usually located in the labia, forehead, anus, cervix and nipples. So these are the sites of lesions. These are the other sites of lesions. So a small papule is formed, which is quickly eroded to form an ulcer. So firstly, there is a small papule, and that will quickly get eroded, and it will form an ulcer. So the margins of this ulcer is raised with smooth shiny floor. The ulcer will be painless. The inguinal glands are enlarged and painless. This cancre heals spontaneously in 1 to 8 weeks, leaving a scar mark. Heals within 1 to 8 weeks. Next is secondary syphilis. It is occurring within 6 weeks. Within 6 weeks to 6 months. So which is from the onset of primary cancre, so 6 weeks to 6 months from onset of primary cancre. The secondary syphilis, it may be evidenced in the vulva in the form of condylomata. So evidenced in the vulva. So these are, first one you will see, it is a cancre, and secondary syphilis, it's all about condylomata. So these are cores. Okay, cancre, here condylomata. So these condylomatas are coarse, flat topped, moist, necrotic lesions. Necrotic lesions and teeming with treponemes. So patient may present with systematic symptoms like fever, headache, and sore throat. And even you can see there is a skin rashes, which is maculopapular skin rashes, which is seen on the palms and maculopapular rashes, which is seen on the palms and soles. So other features include generalized lymphadenopathy, mucosal ulcers, and alopecia. So this stage can last up to 2 years. Next one, latent syphilis. It is quiescence phase after the stage of secondary syphilis has resolved. After the secondary syphilis stage has resolved, so you will see latent syphilis. So this latent syphilis, it varies in duration from 2 to 20 years. Next, coming to tertiary syphilis. So about 1/3 untreated patients. About 1/3 untreated patients progress from last latent stage of tertiary syphilis. Okay. Lastly is tertiary syphilis. So this progresses like that. It also damages the central nervous system, CNS, cardiovascular system CVS, and musculoskeletal system. And the patient even may present with the cranial nerve palsies. Patient presents with cranial nerve palsies, which is of 3rd, 6th, 7th, and 8th. 3rd, 6th, 7th, and 8th. So also hemiplegia, cranial nerve palsies is the first one. Hemiplegia is the second one. And third one is tabes dorsalis. Aortic aneurysm, and gammas of skin and bones. Okay, so these are the patients presenting with the tertiary syphilis. So tertiary syphilis, it is characterized by gummatous vessels. So gamma presents on the skin and bones. So it is characterized by gamma. Gummatous ulcer, it is deep punched ulcer with rolled out margins. Next one is congenital syphilis. So congenital syphilis is the patient here presents after the tertiary stage. Okay, it is congenital means which is from the hereditary basis, which acquires from the delivery of the baby. After the delivery of the baby from the affected mother, it will be transmitted to the baby. Next, coming to this diagnosis of syphilis, the first one is history of exposure to an infected person, and identification of the organism may be Treponema pallidum, which is an anaerobe. A smear has to be taken for identification. Next one is serological test, VRDL. This is common flocculation test which is performed and is positive after 6 weeks of initial infection. So this is all about the syphilis here, of the diagnosis of this syphilis. Next we will see on the miasms, organon of medicine. We will see organon of medicine now. So here there are 3 types of miasms. Okay, Sora, syphilis and psychotic miasms, and recently there has been addition of one more miasm, which is tubercular miasm. And this definition of this is syphilis here in organon is the syphilis. It is a venereal chronic miasm manifested outwardly by venereal cancre, primarily manifested by cancre after an impure coition. So primary manifestations of the syphilis. The primary manifestations of syphilis is the venereal cancre developed after an impure coition. After impure coition, there is cancre developing. So this venereal cancre appears usually between the 7th and 14th day. Appears after the impure coition and usually between 7th and 14th day. Rarely it may be sooner or later. Mostly on the member infected with the miasm. At first, there is a little pustule which changes into an impure ulcer with raised borders and stinging pains. If it is not cured, it remains standing on the same place during man's lifetime, only increasing with the years. The secondary symptoms cannot break out as long as it exists. Next, we will see secondary manifestations of syphilis. So there are 2 manifestations. Firstly, there is venereal cancre, as I have explained the types, which is primary, secondary, latent, tertiary and congenital. So in organon also there is primary manifestations and secondary manifestations. So when the allopathic physicians destroy this cancre by means of anything like corroding, cauterizing and desiccating substances, so the cancre is replaced by a more painful substitute, which is the bubo, which hastens outwardly towards suppuration. So this is somewhere by means of corroding, cauterizing and desiccating substances, this cancre has been suppressed. So when they are also out this bubo through though their injurious treatment, the nature develops far the more secondary causes and break out with a chronic syphilis here. So it destroys tissues, organs and bones, and thus produces serrations, bone caries, etc. And next, coming to Metra Medica here, I just don't want to just give you certain remedies all without basis of this symptom totality. I just want to say the basis, it is the symptoms should actually be based upon the totality of symptoms, where the patient's characteristics and his symptoms has to be individualized, as every patient is individual, and the similar remedy, simillimum to that patient has to be selected. So I just want to give you an example how antisyphilitic remedies will be there. So I just want to consider Tuja because it is a deep acting miasmatic remedy here. So I just thought of considering that. It is indicated on the substrata of psychotic and syphilitic history. It is indicated in the psychotic and syphilitic cases. Next, it counteracts the bad effects of vaccination also, and in gonorrhea and in after effects of maltreated or suppressed gonorrhea. In gonorrhea, where ill effects of maltreated and suppressed gonorrhea, strong action is over the syphilitic, strong action over lymphatic secretions. So the gonorrhea discharge here, you see, it is thin and greenish and is accompanied with scalding pain during urination. So the urethra is swollen, as a result of which there is a retention of your drops of urine which ooze out and soil his clothes sometime after urination is finished. So whenever there is a maltreated or suppressed gonorrhea, so then you can think of this Tuja occidentalis. Even I have said gonorrhea and syphilis comes under this sexually transmitted infections. So gonorrhea is one of it. So this remedy is often indicated in after effects of maltreated and or suppressed gonorrhea. Gouty and rheumatic symptoms are to be found abundantly in these patients as a result of such suppressions. So whenever there is a suppression time, the result of suppression, can think of Tuja, best remedy. Next one is prostatitis and impotence and condylomatous growths. So these are to be seen everywhere. Condylomatous growths seen everywhere. Okay, prostatitis, impotence and condylomatous growths. So here the penis is disfigured by the appearance of these warty excrescences. So you see there is a condylomatous growths. Now coming to syphilitic characters in Tuja. So there is prostatitis, impotence, condylomatous growths which are seen everywhere. So the penis is disfigured by the appearance of these warty excrescences which look like figworts. Tuja, it is meant for figworts, and they are present. The figworts are present in the inner surface of purpose. Inner surface of purpose. So as well as on the point of penis below corona glandis. Inner surfaces of corona glandis, these water growth discharge a sort of a viscid fluid of which the stench is unbearable. Okay, they say it smells like old cheese. Or herring brine. It smells like that, old cheese. The patient even complains of erosions and rawness between legs and on sides of scrotum, from which there is always a constant oozing of moisture. So there is a growth, discharges of a viscid fluid. It smells like old cheese and it smells like orange herring brine. Next is smells like it. This emits a strong sweetish honey-like smell and stains the linen yellow. Inhumans of these warts and excrescences appears above the vulva. They render the parts extremely sensitive. These growths generally indicate a syphilitic taint. So this Tuja on a human constitution is that of a unlimited cell proliferations पे act होता है with such a lot of pathological vegetative growths spongy tumors, and many other varieties of morbid manifestations. It is said to have a strong action over the lymphatic secretions, very strongly over the nervous system also. And whenever there is something like a pathological condylomatous growths or any voice excrescences, then you can think of tuja based on the totality of the symptoms, whenever the remedy is very much similar to that. Similia similis Similia similibus curanta is very much like yours, like in homeopathy. So just don't forget that. And I just